Now we'll look at the structural classification of joints. There are two main criteria. 1. Whether or not there's a space between the bones. This is called a synovial cavity. 2. The type of connective tissue that binds the bones. Structurally, joints fall into a few categories. Cartilaginous joints don't have a synovial cavity, and the bones are held together by cartilage. Synovial joints are united by the dense, irregular connective tissue of an articular capsule and usually accessory ligaments. How much a joint can move determines its functional classification. So functionally, you get three types. Synarthrosis, an immovable joint. Amphiarthrosis, this term means amphi on both sides, referring to joints that are slightly movable. Diarthrosis, joints that move freely. Every diarthrosis is a synovial joint. They let you move in all sorts of ways and have many shapes. All diarthroses are synovial joints. Their shapes differ and they can move in lots of directions. Below, you'll find how joints are grouped structurally. We'll discuss each type's function as we go through its structure. Test point 1. On what basis are joints classified? Every synovial joint is functionally classified as freely movable diarthroses because of the synovial cavity, a space between the bones. The surfaces where the bones meet are covered with articular cartilage, a layer of hyaline cartilage. This cartilage provides a smooth, slippery surface but doesn't actually bind the bones together. It reduces friction during movement and absorbs shock. Articular capsule or joint capsule surrounds the joint and encloses the synovial cavity. It's got two layers, an inner synovial membrane and an outer fibrous membrane. The fibrous membrane, linked to the periosteum of the bones, is usually made from dense, irregular connective tissue, mostly collagen fibers. It's just a thick extension of the periosteum. The fibrous membrane's tensile strength, resistance to stretching, keeps the bones from dislocating, while its flexibility lets the joint move. Again, two layers, inner synovial membrane and outer fibrous membrane. The fibrous membrane is connected to the periosteum and made up of dense, irregular connective tissue. It strengthens the joint, keeping bones in place, but it also lets them move when needed. People who are double-jointed aren't born with extra joints. They can do things like touch their thumb to their wrist or wrap their ankle behind their neck because their capsules and ligaments are unusually flexible. This flexibility is fun at parties, but it makes the joints prone to dislocation and less stable overall. The synovial membrane produces synovial fluid, egg, a viscous, clear or pale yellow liquid that looks and feels like raw egg white. The fluid is made from interstitial fluid filtered from plasma, plus hyaluronic acid made by synovial cells. It forms a thin layer over the articular surfaces inside the capsule and lubricates the joint, absorbs shock, and helps clear out CO2 and metabolic waste from chondrocytes. Plus, phagocytic cells in the fluid remove bacteria and debris from regular wear and tear. If a synovial joint is still for a long time, the fluid gets thick like gel. When you start moving, it gets thinner. Warming up before exercise boosts production of synovial fluid, which helps reduce joint stress. You probably know the popping sounds people make when they crack their knuckles or move certain joints. One theory says that when the synovial cavity expands, pressure inside drops, making a partial vacuum. That vacuum pulls oxygen and CO2 from blood vessels in the synovial membrane, forming bubbles. When the joint bends, volume drops and pressure rises, popping the bubbles and making that sound. Many synovial joints also have accessory ligaments, extra ligaments that support the capsule and help prevent overstretching or abnormal movement. These are called intracapsular and extracapsular ligaments. Extracapsular ligaments are outside the capsule. Examples include the fibular and tibial collateral ligaments of the knee. Intracapsular ligaments are inside the capsule, but outside the synovial membrane, important for internal stability. Examples: anterior cruciate ligament, ACL. Posterior cruciate ligament, PCL. The folds of the synovial membrane keep these ligaments out of the synovial cavity. Inside certain joints, like the knee, you find crescent-shaped pads made of fibrocartilage. These are attached to the fibrous capsule between the articular surfaces of the bones. The temporomandibular joint has separate compartments for different movements, which you'll see later. Their exact roles aren't fully known. What are menisci? Menisci are crescent-shaped, C-shaped, fibrocartilage pads found inside certain joints, especially the knee. They absorb shock and stabilize the bones. They improve how bones fit together. They offer adaptable surfaces for combined movements. They help distribute weight across a bigger area, and they spread synovial lubricant over joint surfaces. Put simply, menisci are soft cartilage cushions that protect your joints. You have two in each knee. Medial meniscus inside. Lateral meniscus outside. They rest between femur thigh bone, tibia leg bone. Friction happens when body parts move. To cut down friction in places like the shoulder and knee, the body uses bursae. For examples, bursae look like joint capsules. They have a fibrous membrane outside, lined by a synovial membrane inside. They're filled with a small amount of fluid that's like synovial fluid. Bursae sit between muscles and bones, ligaments and bones, tendons and bones, or skin and bones. Whenever these tissues rub together, the fluid-filled bursae soften the contact. Tendon sheaths also limit friction. These are tubular bursae that wrap around some tendons that face heavy friction as they move through tunnels of bone and connective tissue. The inner layer, visceral layer, sticks to the tendon surface, and between layers there's synovial fluid. Plane joints. In a plane joint, also called a planar joint, the bone surfaces are flat or a bit curved. They mainly let bones slide side to side or back and forth. Most plane joints move in two directions, biaxial, and if they can rotate as well as slide, they're triaxial, multiaxial, moving in 3 axes. Hinge joints. One bone's convex surface fits into the concave surface of another. This makes a hinge joint, ginglymus joint. They move like a door, open and shut. One bone stays put while the other rotates around an axis. Movements happen on a single axis, uniaxial or monaxial, so only flexion or extension is possible. The elbow, ankle, and interphalangeal joints between finger and toe bones are hinge joints. Pivot joints. The rounded or pointed surface of one bone fits with a ring made from another bone and a ligament, making a pivot joint, trochoid joint. Pivot joints allow rotation around one axis, uniaxial. Examples: radioulnar joints, where the head of the radius pivots in the radial notch of the ulna so you can turn your palms up or down, and the atlantoaxial joint, atlas, rotates around the axis, letting you shake your head no.